Herniated disc syndrome. A herniated disc is a medical ailment in which a person experiences back discomfort that radiates down the leg, making simple daily activities difficult or impossible. A herniated disc, often known as a herniated disc or a drooping or flaccid disc, is one of the reasons of back discomfort. The spine is made up of vertebrae that are connected by discs, which are small, rounded cartilage linings. The annulus fibrosus is the tough outer layer of the disc, and the nucleus pulposus is the softer inner layer. When a disc herniates, a little portion of the nucleus pulposus is pushed into the spinal canal through a small incision in the ring that surrounds it. Nerve stimulation can result in discomfort, numbness, or weakness in the back, hand, or leg. Symptoms of a herniated disc. Because a herniated or protruding disc can sometimes be observed by imaging the back in persons who do not have any symptoms indicative of a herniated disc disease, they may be unaware of it. Disc herniation symptoms. The following are the most prevalent signs of a herniated disc. Radiating pain that starts in the buttocks and travels down the back or side of one leg, sometimes with pinching or numbness. Lower back pain, numbness, or weakness in one leg, back of neck, shoulder, chest, or hand. Back or leg pain that worsens and escalates after coughing or sneezing while sitting. When should you consult a physician? If a person has back pain that limits his movement for more than a week, he should see an orthopedic expert to have his health evaluated, as back pain can be a limiting issue that interferes with daily activities for 1 to 3 weeks. After 4 to 6 weeks, the pain usually diminishes and the movement restriction decreases dramatically. If a person's movement restriction persists after 3 weeks, he should see his primary care physician for an assessment. If the discomfort gets worse when you sit, cough, or sneeze, you may have a herniated disc. Symptoms that must be treated right away. In the following situations, you should get treatment right away. Urinary bladder or bowel control problems. The intensity and worsening of the pain, rather than remaining stable or growing with time. Leg numbness or weakness in one or both legs. A herniated disc or a malignant tumor in the spine can put pressure on a number of nerve roots in the spine, a disease known as cauda equina syndrome, CS. This pressure can cause paralysis, and this condition may require emergency and rapid surgical intervention. Herniated disc disease causes and risk factors. The discs that make up the spine work as propellers, absorbing various shocks and allowing the back to bend. They assist the spine's muscles in protecting it from the pressure caused by daily activities on the back and lifting weights. When a disc herniates, a small piece of the nucleus is forced into the spinal canal through a small incision in the ring around it, triggering one of the spinal canal's neurons. The most common cause of herniated discs is disc dystrophy, which is the cumulative wear and tear that comes with age. The water content of the spinal discs decreases with age, making them less flexible and more prone to rupture or herniation, even when under very light strain. The majority of people are unable to identify the true cause of disc herniation. Using the back muscles to raise huge weights instead of the legs and hands muscles can result in a herniated disc, as well as spraining the back during the lifting procedure, and in rare situations, injuries such as falling on your back or suffering a strong low back disc herniation. Herniated disc risk factors. A herniated disc in the back can be caused by a number of conditions, including 1. Age. Disc herniation is a regular occurrence in middle-aged persons, particularly those between the ages of 35 and 45, as the discs degenerate with age. 2. Smoking. Tobacco use raises the likelihood of having a herniated disc because it lowers blood oxygen levels, preventing body tissues from absorbing critical nutrients. 3. Weight. Excess weight might place undue strain on your lower back's discs. 4. Length. Herniated discs are more likely in those who are taller than average. Herniated discs appear to be more common in males and women over 180 centimeters and 170 centimeters, respectively. 5. Work that puts a strain on the spine. Herniated discs are more common in people who work in physically demanding jobs. Lifting, tugging, pushing, leaning to one side, and twisting the spine on a regular basis all increase the risk of disc herniation, as does work that demands prolonged sitting or standing without changing positions. It also raises your chances of getting a herniated disc. Herniated disc disease complications. Although a herniated disc causes excruciating pain, it is not a medical emergency in and of itself, and only in rare circumstances may a herniated disc produce Horsetail syndrome, which involves crushing and killing the roots of the spinal nerves. Cauda equina syndrome sometimes necessitates emergency surgery to relieve the pain, as failing to do so might result in lasting paralysis or even death.